Good morning and welcome to Community Connections with Children's Services Council of St. Lucie County. I am just one of your remote radio show and Zoom host, Sean Boyle, and with me is
Ashley Mock.
And welcome to the half-hour best way you can start and or ease into your Sunday, even in a COVID-19 environment, by listening to our radio program on 104.5 The Flame at 10 a.m. on every Sunday, where we talk about resources and things that are available for children and families in our great community we call St. Lucie County. Now, we at the Children's Services Council, despite putting on our best radio show host face, both for radio and for Zoom, and we'll explain that later, we are not radio show professionals, but what we do at the Children's Services Council is 5 things for our community, and those 5 things are: 1, make sure every baby's a healthy baby; 2, to stop child abuse before it happens; 3, to keep kids off the streets; 4, to keep them in school; and 5, keep them off drugs, alcohol, and other risky behaviors by offering programs and resources for all families in our community.
And more. I feel like we should start saying and more.
And more. And, you know, for those people that are listening on the radio, we're also televising, or I'm sorry, we're recording this on Zoom, so you can watch us on Facebook, on our Facebook page. And I say all that because I have to message our guest who's in our waiting room. So actually, while you talk, if I look distracted, that is what I'm doing.
Got it. Understood. So Sean talked about those priority areas that we focus our funding on. And again, I said and more, and I meant it. There is a lot changing, a lot happening, a lot more that we are doing right now. But all of that information is available on our website. And that website is cscslc.org. We actually have a list of all of our funded programs there, along with contact information for each of them. And I feel like I've been saying this over and over in the last several weeks, but we keep that information there and we do our best to make sure that it is updated. But 100% the programs are the best contact. So if there is something that you're looking for, if there's something that you're interested in, please use our website as like a precursor to find that information. But there may be things changing day to day that we haven't updated there. So the program directly is 100% your best way to get that information.
Yeah, we just, I should let everybody know, just because, and I'm going to explain why I'm bringing this up later, but it's Tuesday that we're actually recording, because, you know, it's hard to get guests into the studio on a Sunday in a pandemic. So it's a Tuesday, and we just had a team meeting, and we talked about that, about how a lot of the summer programs, for example, are just now kind of figuring and maneuvering their way on what they're going to be able to offer in the summer. So we don't want to publish something that's not true now, because it's the environment's constantly changing. We know that they're all gearing up to serve the community somehow. Some of them are going to serve smaller ratios, for example, but they're all still kind of feeling their way through it. So we are very, as you kind of cautioned everybody, we are not wanting to concretely say what anybody's doing, except to say that they will be doing something, because we're all figuring it out, just like you are, the listener and viewer.
Yeah, and I think specifically that pertains to our summer program information. You know, we always invest a lot of additional money in summer to make sure that kids have safe places to be. I think now more than ever, parents are looking for some of that information, wondering what's going to open, how long they're going to be open. And our answer to that question right now is we don't really know. All of our summer programs are figuring it out. They are working on what that looks like and how many kids they're going to be able to serve, and making sure that they can follow the CDC guidelines. And it's really a big work in progress, but they are working on it, and they are doing their best to make sure they can serve as many kids as possible in the best way.
And we've actually been meeting with all of our many of our after school and summer programs almost on a weekly basis, and we're kind of bringing them together on another project that we'll talk about later on a future show, but more so talking about how they can all work together and kind of share what they're doing so they can learn from each other. So for example, the Boys and Girls Club opened up at the Mid-Florida Credit Union Event Center, formerly the Port St. Lucie Civic Center. They're serving 225 children there, or they have a capacity to. I had the opportunity to do a walkthrough, and they are, you know, social distancing, no more than 9 kids per 1 adult in the room. They've got it all blocked off. They're taking temperatures of the kids before they come in. They are working through every precaution that the CDC has outlined And that's kind of serving almost as a model for some other programs if they have that big enough space. So as Ashley said, we're all working through it, and we kind of always end the show and we're all in this together, and that definitely holds true even more so now.
Yeah,
So
for
I
sure.
wanted to mention, Ashley, real quick, I know we've got a guest in our waiting room because we have a waiting room in Zoom.
Very fancy.
I'm curious to see what it looks like, but because we recorded last week on a Thursday, we kind of forgot to wish everybody a happy Mother's Day.
I feel more than ever like I don't know what day it is anymore.
Yeah,
so,
but
I give us a pass.
That's a legitimate excuse. Good luck playing that off with your mom or your significant other, but we can't let that go. I mean, we kind of missed it last week, and we know we're late, but I just want to wish you, Ashley, and all of our listeners and viewers a happy Mother's Day. And I know, you have such a beautiful family, and I know during this time you've shared some stuff, and we've been on calls, and I've been able to say hi to some of your kids and stuff, and
because they walk through in the background.
I love it. So I just wanted to say happy Mother's Day, particularly to you especially.
Thank you. I think my favorite meme that has gone around the whole coronavirus is the one about, we're going to be in this for Mother's Day, and then everything's going to open up right before Father's Day, because that's just the way it goes.
I don't think that's going to be true, but I appreciate the sentiment. That's kind of funny. And then before we get to our guests, I want to make sure that everybody understands the importance of the census. If you've watched or listened to the show, you know that we talk about it, pretty much every week since at least January. But if you have gotten your card in the mail on the census, it gives you a website. It gives you the identifier number. Please take the 3 minutes that it takes to fill out the census. It's a big push this week and last week, and quite honestly, all the way until we get it done to get the census completed. And quite honestly, if you don't go on the website, and if you don't respond, they're going to come knocking on your door. And, I'm just being honest, in a COVID-19 environment, I don't want anybody I don't know knocking at my door. So
we have a video doorbell for a reason.
Yeah. So please make sure you complete it. And it's so important. And you hear everybody talking about it because, you kind of read about, it means that, our area will get more representation in Washington, or our community may get more representation in Tallahassee. And that may not interest you at all, because sometimes politics can be that way. But let me put it to you another way. They also use population counts on how they come up with their formulas on how funding gets distributed. So we want to make sure that St. Lucie County has everybody counted, so that when they start making those funding formulas, we are very well represented in the true count. And that's how they come up with that figure that the undercount cost your community $1,600 a year per person. That's a significant dollar amount. So laying the gauntlet down for our communities, it looks like overall as a county, we are pretty much keeping up with the state. Port St. Lucie is a little bit better than the state. And Fort Pierce, we got work to do, my friends. We've got work to do. So I guess you don't go around seeing a lot of people anymore. But if you happen
when
to be
texting people,
when you text them, if you got Facebook, if you're Zoom calling relatives, whatever you're doing, any contact, make sure above and beyond, hey, are you doing all right? Are you safe? The next question should be, have you completed your census?
There you go. That's a nice icebreaker for your conversation.
Exactly.
Sorry.
No, go ahead.
I was going to say, I just want to give a quick reminder. I don't know that we've talked about it on the last couple of radio shows, but we are still doing our Small Business Big Challenge. So every Friday, we are matching one of our funded programs with a chamber member business. And they've done really well. It's been really fun. I've gotten to eat some really great food. I know you have too. So keep an eye on our Facebook page, on our website, because we're posting the information there. We hope, you and I have had conversation about, we hope this is something we'll be able to continue to do, maybe not at this level, but
we'll run out of money eventually.
I know it's been a little costly for us, but it's been awesome for our programs and for exposure for the restaurants that are open and working. And it's been really fun, really.
Yeah. All right, so I've got a guest who's been waiting in the waiting room.
Waiting
eh,
room.
Waiting in the waiting room, hanging out in the waiting room, in our green room, if you will, eating all the green M&Ms because that's all we have in there. Just kidding. So let me let her in. It'll be a surprise. You ready?
Yeah, we haven't given you any hints either today.
I know.
It's rare. Oh,
There
there
she
she
is.
is.
And her
Hey,
audio's
Sherry.
Good morning.
Good
How are
morning.
you?
Good. How are you guys doing this morning?
I am jealous of your really fancy Zoom background.
I was
got
gonna
there.
Well done. Like I don't think we've ever been this upstage before, Ashley. This is
I
she's
know.
look at that background. If you're a radio listener, this is more enticement to jump on the Facebook and
There you
in
go.
the afternoon on Sunday and look at the video. But Sherry's got everything going on there. She's got
It is
the agency and Kidcare and flowers and herself.
mental health. I like
I'm-
it.
Color me
yeah.
jealous.
So maybe an official introduction would be helpful. So we've got with us today Sherry Siegfried from, I feel like your name has slashes. So Treasure Coast Food Bank / Your Plate / Florida Kidcare. Are there any more that we need to put behind you? All those things.
I think you've got them all.
And let's put in there a great mom as well, because
Thank you so
she posts
much.
on Facebook and she's got some great photos and stories of being a mom. So let's add
We've
in
shared
super
some
mom
great
as well.
stories.
Oh, yeah.
We've shared some stories.
So we brought you on, Sherry, because we're really twofold. We want to talk about Kidcare and health insurance, obviously, but we also just want to give, we kind of, I know as an agency, we've been doing thank yous to a lot of our programs. We've been doing weekly updates. That's really kind of private. I don't know why I'm sharing it now for all our programs, but when I think of during this pandemic, and I think of all the agencies that are really working hard every single day, they're all doing it. But what comes top of mind a lot of times is obviously healthcare workers, the health department, and then immediately, if not in the same breath, I think of the Treasure Coast Food Bank.
Oh, yes. The Treasure Coast Food Bank has been very, very busy during this time, with a lot of extra people being out of work. We're trying to link families with food and basic needs that they have right now.
And you also, so we should kind of, maybe you could let our viewers and listeners know kind of, so the Treasure Coast Food Bank obviously distributes food, but your end of the shop, if you will, is all about getting people connected to state resources.
Yes. The Treasure Coast Food Bank, our mission is to provide families with food and other essentials throughout the Treasure Coast. However, we did realize that it's not just about providing food to our families. So we want to meet their needs where they're at. And my office, Your Plate Health and Wellness Center, as well as our other outreach center, Whole Child Connection, we provide families with enrollment assistance for SNAP, Medicaid, Florida Kidcare, Medicare savings programs. We do a lot of outreach and education to families, as well as try to provide educational sessions to help our families grow and strengthen in their time of need.
Wow. Is Your Plate open right now?
And so right now, Your Plate is closed. We
Okay.
are doing virtual appointments for our families that are in need at this time. Hopefully, we will be reopening soon. I haven't got the official word yet, but hopefully soon we'll be reopening to serve our families again. Yes, but all they have to do is reach out to me if they are in need of any type of enrollment assistance. I have been doing a lot of referrals for families to other services as well. They can just reach out to me by calling the center number, which is 772-464-9617. And I will do whatever I can to help those families. If they are in need of emergency food assistance, they can find our partner sites, which many of the food pantries are still open on the Treasure Coast at our website, stophunger.org/gethelp.
That's awesome.
I would imagine, Sherry, that, as much as we keep hearing that, for some people are out of work for the first time ever, and the strain that that puts on their family. I know you've got your there's a lot of people that are looking for resources or looking for this kind of help for the first time ever, never expecting to be in this situation.
Oh yeah, it's we definitely have seen an increase in people applying for SNAP benefits, which is Supplemental Nutrition Assistance Program, which is formerly known as food stamps. And then a lot of our families too, with the health insurance aspect of things, we want to encourage them to report their change of income, because that might actually lower their monthly premiums that they have to pay for their families. So if they're facing, being out of work, or their income has changed for whatever reason, we always want to make sure that we assist those families in reporting that change to their accounts and their information, so that way we can assist them better.
And does that start, so if somebody's watching and let's say they get some of those benefits and they hadn't thought about that before, maybe they've been furloughed or for whatever reason, can they just simply call you at that number and you can walk them through that process?
Yes, they can call the center number 772-464-9617. If somebody doesn't pick up right away, just make sure that you leave a message and we will return calls as long as you're leaving the message in the order that they were received.
I think, I'll be honest with you, and all this, and Ashley knows, as an agency, we have many conversations about many different scenarios that we believe are happening. I can't say that we even talked about that one, as far as, obviously we talked about how we can connect people to food and benefits, but it didn't dawn on us to think about that because households' incomes are changing, then that means that their benefit may go up and or their premiums may go down.
Yeah, and one of the wonderful things that Florida Kidcare is definitely there for families. It is children-focused health insurance. One of the things that Florida Healthy Kids program has done during this is they have actually eliminated the co-payments through the end of this month, through the end of March, for families for commonly used services. And COVID-19 testing is free for children that are in need through the end of the month as well. So that's one of the wonderful things that they're doing to try to help out during this pandemic situation.
That's outstanding. So why don't we back up a little bit, because we kind of just jumped into what we can do in the pandemic, and there might be some people, I don't know why, but there might be some people who don't know what Florida Kidcare Healthy Kids is. And I think when we're talking about in the middle of a pandemic that obviously affects people's health and even children's health, I think it's important that we know about all the health options that are available for maybe those that don't have insurance. So can you kind of just back us up a couple steps and tell us what Kidcare is and how people can get it and apply and all that good stuff?
No problem. So the reason why it's very important is 1 in 14 children here in the U.S. are uninsured. Approximately 339,000 here in the state of Florida. Florida Kidcare is health insurance for kids and teens. Every state has their own children's health insurance program or CHIP program, and here in the state of Florida, Florida Kidcare is ours. Now, Florida Kidcare does cover 4 different health insurance programs: Medicaid, MediKids, Florida Healthy Kids, and CMS medical service managed care plans. And so it depends on where the families fall. Medicaid is birth through age 18, and normally for Medicaid, families pay nothing. For MediKids, that's birth through age 4. Florida Healthy Kids is for kids 5 through 18, and the CMS plans are for kids with special needs. So there's a program that fits every child for what stage of life that they're in. And like I said, a lot of families through the Medicaid part of it pay little to nothing. There is for families who are over the Medicaid limit, they pay $15 to $20 a month up until the family reaches about 200% of the federal poverty level. And then there is a full pay option available for our families who are over income. And the full pay option, one of the wonderful things that they did this year, 2020, is they eliminated the The deductible, which used to be around $3,000 for families, it is now $0. They eliminated the co-insurance for families. They also reduced the co-payments for the full pay plan to $5 to see your regular doctor, $10 to see a specialist, which is amazing. So it becomes a better value for families, and sometimes it can be a better value than your employer coverage.
You know, I'm excited to hear that, because Ashley knows we spent many a time talking to many people locally and at the state level about how the past structure of Florida Kidcare was really, if you made 1 penny over 200% poverty level, it was really not affordable for any family, mostly because of that deductible.
Yeah.
So I'm excited to hear that that's actually been enacted, because I know a lot of people behind the scenes worked hard on that. But so it's important, because the beauty about Healthy Kids and Kidcare, and I know there's like all these different silos, and I just want our listeners to know, you don't need to know any of that. That's why Sherry is here, and that's why Sherry is awesome, because you can call her and just say, I need health insurance for my children. She'll figure out the right path that you have to go.
Oh, yeah.
But the bottom line is, if you don't have insurance for your children, that there is an option. And even if you have to pay the full pay, chances are it's comparable, if not better, than what you can get in the open market.
Oh, yes, it's definitely wonderful. And one of the other wonderful things that they did this year is they removed the lifetime limit. There used to be a limit that families had that the insurance would cover. And so for families who have children who are really, really sick, once they hit that limit, they were no longer covered, and they removed that lifetime limit. So that is fabulous. So those children are now able to continue with their medical insurance and receive care.
That's awesome. And I know one of the other complaints that Sean and I used to hear was that there weren't enough local providers that were accepting the Florida Kidcare insurance. I know that has changed because my kids receive it. And there are plenty of providers locally. We probably aren't where we want to be, but we do have a really good amount of providers that are accepting that insurance and seeing kids now.
Oh yeah, the provider list changes all the time, but they are definitely updating that. And my son has Florida Kidcare as well. I've never had an issue finding a provider, and I live, more towards or close to a very rural community. So, and I've been able to find providers for my son whenever he's had those needs. And if a family is having trouble finding a provider, they do have resources on the website, floridakidcare.org, to help the families navigate that. They can also call the number on the back of their insurance card to find a provider near them.
And real quick, Sherry, I just wanted to ask, I know May is Mental Health Awareness Month, but Florida Kidcare actually does cover some mental health services too. And I think that's really important for families to know, because it covers some behavior aspects as well.
Yeah, I was going to get to that. During this time, it's very, very stressful, for families, but we sometimes forget, the teens and the children, it can be very stressful on them as well. And they definitely have mental health services for children as well through Florida Kidcare.
So Sherry, if a family, grandparents, parents are watching and their children don't have health insurance, and they're like, you know what? They're talking, they're like, this is a pretty good radio show, but more importantly, we should probably call Sherry at 464-9617. So when they call you, what kind of information do they need to have at hand in order to make the application?
So normally when they call to do the application, you need your basic information, names, birthdates, social security numbers. One of the other things that is very helpful if we have it up front is proof of income, or any kind of immigration documents. If you're a permanent resident, your permanent resident card. Those are things that are helpful up front. If you don't have them at the time of the application, we can still go ahead and complete the application, but that's information that they will request later on. So we like to have all that information up front, so that way we can send it in at the time of the application to move things along a little bit quicker.
Okay. And just so I understand, let's say there's somebody watching and they're like, you know what, Sean, I'm pretty self-sufficient. Ashley, I got this. Sherry, I appreciate it, but I want to do it on my own. They can jump onto the Florida Kid Care website and do it on their own?
Yes, all they have to do is go to floridakidcare.org, hit apply online, and they can apply by themselves. A lot of our families do that, and then sometimes they might run into an issue while they're doing it and contact me, and I'll kind of help walk them through that process, or even sometimes I might have take over to help them along. But we're here for families if they need us. And we are also a member of the Treasure Coast Florida Kid Care Coalition. So there are other agencies that provide the enrollment assistance. And if there is a local assister, once everything is open, that's a little bit closer to them, you know, we will refer the family to those centers as well, because we really want the families to be able to access services that are close to them. You know, we will do whatever we can, but if there is a better fit somewhere else, you know, at a different center, we will definitely refer them to our partners. And we all try to work together to ensure that all kids here on the Treasure Coast are covered.
That's great.
Awesome.
And let me ask another scenario, and we've only got a couple of minutes left. This is usually a time where I ask you questions that we hadn't talked about before. So, let's say I have Florida Kid Care. Okay. Or at least I think I do. And I go to the doctor and they're like, you don't have insurance. And you're like, well, wait a minute. I thought I had Florida Kid Care. Can they contact you to help like kind of navigate? Because I know sometimes the renewals are at different time periods and sometimes people move and sometimes they miss a renewal. Can you help with that as well?
Yes, if they need assistance with renewal, we can definitely help with that. If they're running into an issue where they've gone to the doctor and they don't have insurance, you know, we can help them kind of navigate the system and try to figure out what is going on. It could be that for some reason they didn't send in the needed documents to have their application processed. And we'll work with the families to make sure that they do get back enrolled, or if there was an error or whatever that may be, make sure that that gets cleared up.
So again, I'm going to urge everybody that's listening and or watching, if your children or grandchildren do not have health insurance, call 464-9617 or go to the best named website on the Treasure Coast, which is stophunger.org, and look up Florida Kid Care, and you'll find your way to Sherry. And I just want to, we got like a minute left. I just want to brag on our community and Sherry for a moment. So what seems like a lifetime ago, but was probably only about a year ago, Florida Kid Care, the statewide network, did focus groups all across the state of Florida to find out what worked and what didn't work, and what good practice models there were as far as families accessing Florida Kid Care. And we happen to know the person that did the focus groups. They're from Tallahassee, and we'd worked with them before. And he contacted me afterwards because they did one here in St. Lucie County, and we helped, the Children's Services Council helped them get some people in there for the focus group. And he came back, he called me and said, hey, I just want you to know that I'm writing the report up to tell the statewide association the statewide Florida Kid Care, how they should operate. And I'm basically telling them that they need to follow the St. Lucie County model, which is basically, everybody knows that if you want Florida Kid Care, refer them to Sherry.
Yes, I was so overwhelmed. You know, all of the community partners and other agencies, you know, said so many wonderful things about me and, you know, helping families. But it's not just me. There are so many other enrollment assisters that are out there here on the Treasure Coast, you know, working hard for families. And, you know, we want to make sure that kids are able to see a doctor if they need to. You know, we want to make sure that they're going to school, you know, not missing school because of a toothache, you know, making sure that they get the dental services that they need. And they can do that through Florida Kid Care.
Yeah. And I think it's so important. And if this pandemic hasn't really kind of made this even more concrete, how important it is to have health insurance and medical coverage, not only for the normal bumps and bruises, but quite honestly, if we ever in a pandemic, which we never thought would happen, but it has happened.
Right.
So,
Yeah.
So
Sherry,
true.
I want to thank you so much for coming on. And I also want to end, we're a week late on this, but I want to wish you both a belated Happy Mother's Day again. You guys are fabulous mothers. And I know I see it on Facebook and social media and conversations with the both of you. And I know everybody just greatly appreciates the examples that you guys are both setting.
Thank you, Sean.
Thank
All
you,
right.
Ashley.
It was
You guys
good to
have a
see
good
you,
day.
Sherry. Thank you.
Good to see you guys too. Enjoy your beach.
Oh, thanks.
Thank you. We're going to wrap up. And remember, folks, it's a weekly radio program every Sunday at 10 a.m. on 104.5 The Flame. It's an occasional TV program thanks to Zoom. But remember, it's our children, our community, our future. More than ever, we're all in this together. We'll see you next time.
Bye, everyone.